Is a high white blood cell count always a sign of infection? In recent news, many people are curious about the implications of a high white blood cell count. This topic has gained attention, especially as health concerns continue to rise. The question on many minds is a high white blood cell count always a sign of infection? Many individuals believe that a high white blood cell count, also known as leukocytosis, indicates that the body is battling an infection. However, the reality is more complex. White blood cells serve as the body's primary defense against harmful invaders. When bacteria or viruses enter the body, the immune system often responds by producing more white blood cells, particularly neutrophils, to combat these threats. This is why healthcare professionals often check white blood cell counts when they suspect an infection. However, infection is not the only reason for an elevated white blood cell count. The immune system can react to various forms of stress. For instance, physical stress from surgery, intense exercise, or trauma can lead to an increase in white blood cell numbers. Emotional stress and certain medications, such as corticosteroids, can also cause similar effects. Additionally, some medical conditions that are not infections can raise white blood cell counts. Inflammatory diseases like rheumatoid arthritis or inflammatory bowel disease can trigger the immune system to produce more white blood cells. Certain cancers, particularly blood cancers like leukemia, can cause high white blood cell counts due to the production of abnormal cells. In some cases, a high white blood cell count may not be beneficial. For instance, in severe cases of COVID-19, high white blood cell counts have been associated with worse health outcomes. This is not always due to a secondary infection. Sometimes it reflects an overactive immune response. In summary, while a high white blood cell count is often associated with infection, it is not the only cause. The immune system can increase white blood cell numbers for various reasons, including non-infectious stress, inflammation, medications, and certain diseases. Healthcare providers use additional tests and consider the overall health picture to determine the underlying cause. So, when discussing high white blood cell counts, keep in mind that infection is a common reason, but not the sole explanation. The immune system has multiple ways to respond, and understanding the context is essential.